Be careful. Do not attempt to repair or interfere in any way with the electrical equipment. To prevent the risk of electric shock, call for a qualified electrical technician's help. Look first, and don't touch. The person may still be in contact with the electrical source. Turn off the source of electricity if possible. If not, move the source away from you and the affected person, using a non-conducting object made of cardboard, plastic, or wood. Avoid anything wet or metal. Pay attention. Electric current does not stagnate in the body. If you have turned off the power, it will be safe to touch the victim. If the victim is conscious, keep the person still. Evaluate the person's body, and search for electrical injuries. The electric shocks can cause traumatic marks at the entrance and exit points. Call 112 or local emergency services if the person has trouble breathing, loses consciousness, has seizures, has muscle pain or numbness, or is feeling symptoms of a heart issue, including a fast heartbeat. If the victim is unconscious, lay the person on their back on any flat, hard surface. When handling the victim's body, pay specific attention to the maintenance of neutral cervical spine positioning. In this situation, make sure that his airway is clear of any obstructions, and check the victim's vital signs. The victim's airways will be opened by anterior subluxation of the mandible, while the head and neck will be kept in line to release the base of the relaxed tongue, which can block the throat and partially or completely obstruct their breathing. With the victim's airway open, place your ear near the victim's mouth. Look to see if the person's chest is rising and falling. Listen over his mouth and nose for breathing sounds. Feel his breath against your cheek for 10 seconds. If the victim is breathing, keep the person still and look for any injuries produced by electric shock. If the victim is not breathing, call 112 for emergency assistance as soon as possible, and begin cardiopulmonary resuscitation as follows. Put the person on his back. Kneel next to the person's neck and shoulders, and place the lower palm of your hand over the center of the person's chest. Place your other hand on top of the first hand and compress the chest at least 5 centimeters but no more than 6 centimeters. Push hard at a rate of 100 to 120 compressions a minute. After 30 compressions, give 2 rescue breaths. Pinch the nostrils shut for mouth-to-mouth breathing, and cover the person's mouth with yours, making a seal. Continue resuscitation until there are signs of movement, emergency medical personnel take over, or you are too exhausted to continue. During resuscitation, try to keep the victim's head still. Make sure all electrical equipment is checked by authorized personnel. Do not attempt to repair or interfere in any way with the electrical equipment. These operations will be performed only by authorized electricians. Turn off the source of electricity if possible. If not, move the source away from you and the affected person using a non-conducting object made of cardboard, plastic, or wood. Don't touch the person if he's still in contact with the electrical source. Check the victim's level of consciousness and vital functions. And act accordingly, as described above.